name is Henry Lim. I am a dermatologist practicing in Henry Ford Hospital in Detroit, Michigan. I am also the president of the International League of Dermatological Societies, the world's largest dermatological organization. They are a very good question. There are definitely a lot of disparity among access to care for skin health in different parts of the world related to the resources that are available to the country, resources that are available to the populations. So ILDS is doing our best to help to address that. Obviously, we cannot address every single problem in the world, but we do give out grants to support access to skin health. We do provide grants for exchange of interaction, exchange of departmental expertise across the region, across the world, so that the better care and more equitable care can be achieved for many of the patient population. Very important question. This is a reflection of the consensus conference that I, together with 3 of my colleagues, organized in Amsterdam late last year. The results have now been published in the Journal of Investigative Dermatology. In that conference, we convened about 25 world experts on visible light photoprotection to address that very question that you just asked. The conclusion is that for screening purposes, they are simple in vitro method that could evaluate whether a particular product, a particular compound has a visible light photoprotective capacity, specifically having an absorption spectrum in the visible light range. However, we also recognize that for the actual assessment of the product, an in vivo method is needed because we need to be able to see what is the effect of visible light on the skin in terms of pigmentation and in terms of erythema. So you'll hear more about this as we continue to develop and refine these recommendations. First of all, I'm honored to be invited as one of the editor-in-chief. The important part of this journal, this is an English journal published in China, is to provide a venue for Chinese dermatology to be able to be broadcasted around the world, because there are very significant advances over the past 20 years in dermatology in China, from clinical research, clinical care, translational research to basic science research. The world is getting to know that very, very well, but I think it is important for the world to know even better what has been accomplished here. At the same time, this will be an opportunity for the world to be able to submit articles to this particular journal so that there is a good exchange of information, exchange of knowledge between international and Chinese dermatology.